Welcome to a special year in review at Wimmera Health Care Group. And as our board chair has previously commented, the financial year of 2020 to 2021 was the most difficult period our team members had ever experienced. It was emotionally and mentally challenging, but it gave our members a chance to shine and show their resilience. Appropriately, our financial year started in the International Year of the Nurse and Midwife and finished in the International Year of Health and Care Workers. International recognition is nice, but the support and kindness from our own community is what really matters. Our resilience and positive attitude was demonstrated early by our superhero, Captain COVID. At the start of the financial year, the COVID-19 pandemic was panicking the community as positive cases emerged among local residents. Our team was trying to keep the community calm when suddenly a mild-mannered infection control nurse transformed into Captain COVID to become a genuine hero and make sure everyone knew how they could best keep the community safe. Not long after, we introduced a drive-through testing clinic to deal with the large numbers of people testing daily. Australian Defence Force personnel joined our team to ensure the operation was seamless and meet the community demands. More than 2,000 Wimmera community members were tested during the drive-through operation. It was a very busy period, but again, our team showed resilience and maintained its sense of humour. In December, we told you about an amazing relationship between WHCG occupational therapist David Singh, the Wimmera nursing home team, and a beautiful, determined lady named Kath. David was supported to start a new program that had a profound impact on aged care residents and produced genuine improvement with several of them. In May, Donald's Tanya May became the first community member to receive the Pfizer vaccination in Horsham. WHCG nurse Brooke Delahunty administered the vaccine to Tanya. Our new community COVID clinic opened in April, and CHS Group Director Tim Hopper was the first to receive the vaccine in our McLaughlin Street clinic from vaccination nurse Carolyn Baird, who came out of retirement to support us. Grampian's Public Health Unit was also instrumental in supporting us all to have pandemic plans for residential aged care, respond to the ever-changing health directions, set up COVID swabbing and vaccination services, and keep the system functioning. We also commenced a region-wide telehealth service, the Better Care at Home initiative, and supported extra surgery to be undertaken at Horsham. It has not been easy to convince everyone that vaccination is the best way to beat the pandemic. With the support of Dr. Rob Grenfell, head of CSIRO's Health and Biosecurity Department, we released a series of videos to help answer the many questions being raised in the community. The generosity of our community has played a big part in maintaining the team resilience. Knowing we have the support of our friends and families, as well as community benefactors, helps keep our team smiling behind their masks and maintaining safe, quality care. 5-year-old Horsham Lutheran Primary School student Ella Ryan was the epitome of community support. She had become concerned about our health workers, so she saved up her pocket money and then presented the contents of her money box to WHCG Clinical Risk Manager Roxanne Tucker. The correct use of respiratory protective equipment should be considered the last line of defence when it comes to controls and infection prevention measures. In May, Ballarat Health Services employed Respiratory Protection Program fit testers for the Wimmera region to complete fit testing of protective masks. We introduced Wellbeing Officer Lux Pereira to support team members and let them know there was a qualified social worker they could turn to when the work-life balance was getting difficult. In November, Currajong Lodge resident Margaret wrote a letter to the media to say how heartened she had been with the level of care shown to her during COVID-19. The retired school teacher was full of praise for her carers and said she felt safe throughout the pandemic. Also in November, we asked retiring Director of Medical Services, Professor Alan Wolfe, to talk about his 36 years at Wimmera Health Care Group and the illness that ended his career prematurely. His story unfolded in a series of videos that made popular viewing. A few months later, the board unanimously chose to rename our medical centre the Alan Wolfe Medical Centre. Late in March, Wimmera Health Care Group Infection Control Coordinator Rachel Baker was the first team member to receive her COVID vaccination as the rollout program launched in Horsham. As masks became compulsory facial wear, Captain COVID returned to show us how to wear them properly. We also made demonstrative videos for the community on mask wearing and on what is expected when visiting your health service. Our Ladies Auxiliary worked even harder to raise funds despite their opportunity shop having to close for long periods of lockdown. The Auxiliary maintained a COVID-safe environment in the op shop to keep the till ringing and were able to donate an entire system for providing blood pressure monitoring to a central screen in the emergency nurses station. Friends of the foundation continued to run COVID-safe events and raise funds for the foundation, which continued its amazing support despite constant closure or postponement of fundraising events. The foundation donated 2 new portable ultrasound machines to make the treating of patients a lot easier for our surgical and emergency nurses. Horsham's Blue Ribbon Foundation also endured many cancellations and postponements of important events, but still managed to raise $30,000 for a neonatal resuscitator that will inevitably save the lives of newborn babies needing respiratory support. Community support has been amazing, including a donation from our hospice auxiliary allowing us to refurbish and extend a new palliative care room. Horsham Apex Club donated a portable ultrasound machine to Wimmera Cancer Centre for patients on dialysis treatment. Horsham Relay for Life Committee presented a $4,000 cheque to Wimmera Cancer Centre from money raised with the sale of recipe books. A $500 donation from Commonwealth Bank staff provided a nice Christmas gift for Wimmera Cancer Centre patients. With help from Horsham's Brian Wild, Coles have donated bench seats made from 98% recycled plastics. And staff and management at Horsham's Woolworths supermarket has thanked customers for helping them raise $5,000. In December, we thanked all our volunteers for the wonderful contributions they continually make to our health service and to our community. The Wimmera Mallee Southern Health Alliance focused on a few key projects, including the Psychological Peer Support Program, the Buy 5 project, and the Rural Mental Health Initiative. West Wimmera Health Services provided support by taking on subacute patients at the start of the pandemic so we could open a dedicated unit for COVID and suspected COVID patients. That unit is still in use and ready for any surge. Community members also helped to identify a number of areas where we could improve. We are very grateful to receive all communication to help us provide high quality and safe care. Changes that we implemented based on feedback included changes to COVID testing privacy and changes to how we communicated with patients and residents about visiting WHCG during COVID. Deakin University continued to support us with the Your Thoughts Matter project. The expanded partnership discussions with Ballarat Health Services, Stawell Regional Health Service and Edenhope District Memorial Hospital allowed us to engage with a broad range of stakeholders and understand what are the key things they need their health service to deliver. During August, we also announced the appointment of a dedicated prostate cancer nurse, with Mandy Johns moving into the role after transferring from her continence nurse role. Since the COVID pandemic began, there has been a 20% reduction in cancer diagnosis in Victoria. This means whether through restrictions or fear, people are avoiding their GPs and health services. The pandemic also provided opportunities. In August 2020, we appointed Dr. Faria Islam as Horsham's first neurologist. In October, the Melbourne Cup visited the Wimmera Health Care Group. and many team members and aged care residents got their photo taken with arguably Australia's greatest sporting icon. Wimmera nursing home resident Bonnie was more excited than anyone because her grandson Paul Pruska trained the pre-race favourite, Surprise Baby. And Captain COVID returned to our social media sites to remind us to keep our distance. We thank the community for following the COVID-safe regulations so diligently and working together to keep our community safe, and for engaging with us to support us to deliver Wimmera-wide caring, quality health and well-being. It has been a difficult and challenging year, but an amazing year, and we want to thank our team for being exceptional at remaining upbeat and positive while keeping us all safe. But we also want to thank you for being a supportive community right throughout. Please remember, we are still in a pandemic and Captain COVID still wants us to wash our hands regularly, wear our masks, maintain our social distancing and stay home if you're not well.